My name is April DeVos, and I'm one of the nurses here, and I'm here to discuss dermal fillers with you. Dermal fillers are a hyaluronic acid-based molecule that we inject into the skin to either create volume or to help smooth out some fine lines and wrinkles in the skin. So we use dermal fillers throughout the entire face here, but there is some areas that we need to avoid just due to safety. But for the most part, the popular areas for filler is through that lower face, so through our cheeks, our lips, and then that jawline there. We also do have fillers that we can place in areas such as the hands to fill that out for the aging process. So when you are interested with dermal fillers and you make that appointment, we will want you to avoid NSAIDs, aspirin, all of those blood thinners just to decrease that risk for bruising. We will want you to come to that appointment makeup-free with naked skin so we can really get a good visualization of your skin health and any kind of deficits that we're working with to increase that volume. Some areas we will apply a topical numbing agent in the office. In other areas we will use ice and distraction tools for comfort level. And then afterwards, you're gonna go home and do just basically being very gentle with your skin. You're gonna have a couple days of some mild swelling, maybe a little bit of redness at those injection sites, and then also just keeping your head upright for the next 4 to 6 hours. Results for filler will be pretty instantaneous. We will actually show you either a side-by-side or before and after photos right at your appointment, and you can instantly see those beautiful results and the changes in your skin. Now, the risk for bruising is there, and if you do bruise, we say about 2 weeks for that bruise to heal and go away. But other than that, you have instant results with filler. So at Blush, we love the saying, the best injectable is the least detectable. So we really are trying to just make you look like a more youthful, more vibrant, well-rested version of yourself. So a lot of our patients will wonder, how much filler do I need? And it really is determined by what filler we're using and the location in your face. So for lips, for instance, we can go as subtle as maybe, a half a syringe or even less for just like a little hydrated look where we're just giving you a little bit of a lip pop, up to kind of almost a whole syringe for lips. As far as cheeks, we kind of say 1 syringe for every decade of life you are. Now, everyone's natural anatomy is a little bit different, but that's kind of a general rule of thumb. So how often you're gonna need filler is really determined based on your metabolism and how much product we place in your face. Certain things like if you are very animated and you talk a lot, that will also kind of wear down that filler a little bit sooner. It also will be determined on which filler we select for you. So some filler products maybe only have about 6 months, whereas other filler products that we offer will be up to kind of 15 months. So if you are interested in any of our injectables, fillers, or wrinkle relaxers, or if you currently have them and you're interested in receiving those treatments at Blush, please reach out to us and you can schedule a consultation.